Hi, I'm Dr. Sargent. I'm an internal medicine physician and founder of Monrovia Internal Medicine and Primary Care. I'm also a USCIS civil surgeon. That means I'm authorized to conduct your immigration medical evaluation and sign your I-693 form. Now, I know all too well how confusing and expensive this whole process can be, but I've been doing it a long time, so I promise you're in good hands. In this video, you'll learn everything that you need to know to meet the medical evaluation requirements to complete your I-693 form. We're going to talk about what the USCIS wants to know about your health and how that's collected on your I-693 form, how long it takes to complete the I-693 form, and what sorts of things might affect your timeline, and finally, the cost. Number 1, what do they want to know? So what does the USCIS want to know about your health? To put it simply, the USCIS basically wants to know if you have anything that can be considered a public health risk. That's all. They just want to make sure that there's nothing about your health which poses a risk to others. That's why on the I-693 form, they require documentation about your history of vaccinations, a review of your past medical and mental health history, documentation of certain laboratory requirements, as well as a complete physical examination. Let's take a look at each of these. Physical and mental history. This part's pretty easy. I'll just ask you a bunch of questions and jot it down. It's important that we do this because the history of your health will tell me if you need additional vaccinations or blood work. Vaccinations. How do you know which vaccines you need? Well, again, that's where I come in. If you have any records of your vaccination, you and I could review it together to make sure that you meet all USCIS requirements according to your age and health. If you don't have a vaccination record, don't worry about it. I'll let you know what you're missing and how to get it as affordably as possible. But to get an idea of which vaccines you might need, visit this website. Laboratory requirement. Everyone needs to prove that they don't have a positive quantiferin blood test. That's the blood test that we use to check for tuberculosis exposure. It doesn't matter how old you are. Everyone needs this test. In addition, all adults and kids aged 15 years old and older must also get a syphilis blood test and a gonorrhea urine test. Number 2. How long is this going to take? The length of time to complete the I-693 form varies on a case-by-case basis. But for the most part, we can turn it around within 2 to 3 days. That's because lab results usually take that long to come back. But there are certain other things that might affect your timeline. For instance, if you decided you wanted to go elsewhere to get your vaccinations and blood work completed, such as your doctor's office, that's perfectly allowed, but it does add to the wait time. Another example of something that could prolong things for you is a positive tuberculosis test. If your quantiferin gold blood test is positive for TB, then we'd have to check a chest x-ray before we could complete the I-693 form. And if the chest x-ray came back positive, then a special section of the I-693 form would have to be completed by a health department official. As you can see, there are a number of possible factors that can prolong this process for you, so please allow enough time to complete it. Number 3. How much is this going to cost? This is the most popular question we get, and rightly so because this process is not cheap. Sorry, but there's no way to sugarcoat that fact. Though we think our consultation price is pretty reasonable, The rest of this process can cost upwards of $1,000 depending on your age, how many people in your family are being evaluated, how many vaccines you need, and the condition of your health. Vaccines are hands down the most expensive part of this whole process. For instance, just one injection of Pneumovax can cost nearly $300. And if you require multiple vaccines to be compliant with USCIS standards, your cost could be as much as $600 just for your vaccine requirements alone. Now don't worry, this is a worst case scenario. Most of our patients don't come close to paying that much for their care. That's because we bend over backwards to try and find the most cost-effective way to complete this process for you. Our consultation fee is just $185 per person. This is a one-time fee and includes all of your visits to the doctor, your physical examination, coordination of all your materials, and completion of the I-693 form. Unfortunately, our consultation fee does not include vaccines or laboratory studies. Those are separate. We separate them out because some of our patients are able to use their health insurance plans, and our priority is to help lower your cost as much as possible. So if you have health insurance, we can help you get some of your requirements covered. If you don't have health insurance, we can still help you lower your costs. On the average, our patients pay approximately $400 for everything, including our consultation fee. How should you get started? My recommendation is to book an individual case review with me. We can meet by phone or video, and I'll review all of your vaccination records, your medical background, and your laboratory studies. I'll let you know what materials you're missing and how to get them at an affordable price. I'll also be able to better estimate your timeline for this process. The case review is just $49, but becomes a part of the $185 consultation fee if you decide to move forward with us. And that's it. If you have any questions, we're happy to answer them for you. Just give our office a call at 877-254-4496. Hope to see you soon.